Welcome back, everyone. In this morning's Health Watch, we begin a new series called Heart Score. Over the next few days, we'll look at ways to avoid the #1 cause of death in this country, cardiac disease. Our Dr. Jennifer Ashton begins this morning with the 4 vital heart numbers that we should all know. Good morning, Doctor.
Good morning, Maggie.
Number 1 is your cholesterol.
Cholesterol, but first a disclaimer, we're not talking about key things here like family history and smoking.
Okay.
Here we're talking about numbers. Now, when you talk about cholesterol, magic numbers are 240 and 200. Over 200 for everyone is considered suboptimal. You're considered high risk if your total cholesterol is over 240. Now, in terms of the healthy cholesterol, the HDL, you want that number high. The lousy cholesterol, the LDL, low. And if you have a history of heart disease, very low, under 100.
But the 200 and the 240 refers to the combined score
correct.
of LDL and HDL.
Yep.
And that's more important than the individual number?
They're all important.
They're all
you should have them
important.
checked yearly.
And you have to go to the doctor to have them checked?
Blood test.
All right. With blood pressure, it's a little different. You can check it at home.
That's
what would
right.
a device like this tell you?
Well, you're looking at 2 numbers, and the numbers you want to keep in mind are 120 for the top number, or the systolic, and 80 for the diastolic, or the lower number. The top number reflects how much pressure is in our arteries when the heart contracts, and the lower number reflects the pressure in our arteries as it relaxes. Again, you don't base it on one number, one reading, but several sequential ones, and 120 over 80 is the number you want to keep in mind.
What if it's only slightly higher than that? Could that still be a problem?
You need to repeat it, and even one number being elevated could be significant. Yep.
All right. The next number you should know is your BMI. What is that?
Body mass index. It's not ideal, but it's a way we can reflect our risk for obesity. You want your body mass index to be under 25. You can calculate it online. It's basically your height in inches and your weight in kilograms, and you want that number lower. I mean, no secret, obesity is a major risk factor.
Heard the First Lady talk a lot about that this week.
Absolutely.
Lastly, know your waist measurement. Why?
Exactly. People who are pear-shaped or carry a lot of fat around their belly, for women it's 35 inches, for men it's 40, are at much higher.
That's max.
Exactly.
Okay.
You want it below those numbers, are at much higher risk for heart attack and stroke. So again, it's not just your overall weight, but it's where you carry your fat that's relevant.
And even if your BMI is okay, if that number's not, in other words, it all goes together.
If you're
doesn't it?
pear-shaped or carry that weight around your middle, you're at high risk.
Before you go, I want to ask you if you think we should take any precautions during the snowy weather, because it is the big story of the day.
It absolutely is. And we have to remember things like back injuries, slips and falls, heart attacks, very important. You're really exerting a major stress on your heart when you shovel snow, so you want to take breaks, go inside, and if you have any chest pain, stop immediately.
All right, Dr. Jennifer Ashton, thank you, Jen.
Bet.